Good afternoon. Latest COVID numbers today about 834 cases. We continue to be in the 800. So this is a higher number than we had experienced in prior weeks. We're going to get into today hospitalizations because a lot of folks ask, well, what is it that we look towards and plan towards? It really is making sure that we have the hospital capacity so that those who get COVID have the best chance of recovering. And of course, there's also capacity for anything you might need. If you have a heart attack, a stroke, appendicitis, any of those other conditions, that we have the ability, and our medical professionals have the ability to save your life. There's just so many things that would have been fatal for people 100 or 200 years ago that are now just a simple operation, a few days in the hospital and you're out. We need the capacity to do that. Some of the areas that have had COVID hotspots have not only seen record deaths from COVID, they've also seen the non-COVID fatality rate go up because people are not going in, are able to get treatment for heart attack, strokes, and all the other things that they do, where they might wait longer to try to seek out that treatment, or they might get a secondary quality of treatment if we don't have the capacity on the hospital side. So we're going to dig deep on hospitalizations. And of course, I do want to express my condolences for the just over 2,000 Coloradans and their families who have succumbed to COVID. Our heart goes out to everybody who's experienced loss. It might have been your brother or sister, your aunt, your uncle, your loved one, your friend, and I want to express a deep condolences. We're not through this yet. I think more of it is behind us than ahead of us, but we need to redouble our efforts to stay safe, wear masks when we're around others, avoid groups, cut down on our social interactions, and be safe. A brief update on the fires. We continue to have record fires. It's important that people know that fire season in Colorado is still very much active. Fire season is not over. The threat continues. In fact, the Cameron Peak Fire, which is the third largest in the history of our state at 128,149 acres, is only 42% contained. And if there are changes in wind, both speed as well as direction, it absolutely could help spread that fire again. Mullen Fire, which is now partially in Colorado, that's the Wyoming-based fire, 170,996 acres. We have two other major active fires in our state. The Williams Fork Fire at 14,000 acres is 25% contained. The Middle Fork Fire at 11,000 acres is 0% contained. And I just want to make sure everybody knows, as we enjoy our fall weather, we are still in fire season, and just some important things to do to reduce the risk of starting a fire. And many of these fires were started by human activity. The majority of them were. If you're traveling, make sure to check on fire and firework restrictions in the area you are. Be careful with anything that could start a fire. That could include a cigarette or cigar, could include fireworks, could include campfires. If you're towing a boat or trailer, make sure your safety chains are secure and not dragging on the ground. Don't park your vehicle over dead grass that can be a tinderbox. Your vehicle can ignite a fire there that can spread quickly. And of course, when camping, be safe. Use improved fire pits where you can, and never ever leave until your campfire is completely dead for the night, or if you're moving on. And a good way to judge that is if it's too hot to touch, it's too hot to leave, right? So if you wouldn't touch it, don't leave it. That can start another fire. There's a lot of county flexibility on implementing fire restrictions. The state open burn order is in effect into early November. We're not yet through this. Hospitalization. I want to dig into kind of who's hospitalized, where, why. It's important that people know this in Colorado. So first of all, historically, looking at hospitalizations, Black, Hispanic, American Indian Coloradans are overrepresented in hospitalization. But lately, there's been a significant increase in the latest growth has been among white Coloradans in hospitalization. The age groups have been stable. The age group with the most hospitalizations is 60 to 69. The average age of a person hospitalized in Colorado is 54. We're going to dig into those numbers. So, I think one of the misperceptions about this virus is everybody thinks it's someone else. It's wishful thinking. It's natural. I'm in my 40s. Which I am. It must be people in their 50s who are going to. You're in your 50s. It's people in your 60s. People who are 65 say, oh no, that's people in their 70s. People in their 70s say, no, that's people in their 80s. Well, guess what, folks? It's actually all of us. We're going to show you who's hospitalized today and who's been hospitalized cumulatively through this whole crisis. Of course, there is a higher risk of hospitalization as you get into your 50s, 60s, 70s, 80s, but there are people hospitalized in every demographic. The length of stay, we're seeing about 4 to 5 days is the average, a long spread. So some people 2 to 3 days, and then what affects that average is some are 30, 40, 50 days. And those are the ones where you get into a much higher risk of them never making it out, right? Longer hospitalizations, people, some of them get better quickly, others don't, and then they may or may not even make it out at all. When they have the 30, 40, 50-day hospitalizations. Hospital admissions has also been growing in the non-metro areas as well. So we go to the next slide there. So this is a really interesting one. This is kind of the key one here that I want to show. It shows the percentage, actually the age one will be even more important. This is by race. So if you look at this, right now, a majority of people hospitalized are white in Colorado. If you look at this cumulatively, it was a lower number. So the whole time it was 41%. Now it's 52%. So the fastest growing group you'll see in a moment are younger and whiter than who's been affected by this overall. The key message here, your race, your age doesn't matter. Wear a mask, be careful, be smart. Just cut down on how many people you see every day. If you're the kind of person that sees 12 people every day, get by for a few weeks seeing 6, right? And trying to be 6 feet apart. And that's how we're going to do this. Next slide. So this is interesting because we're actually at about parity with male and female. This is actually a bit of a surprise because a lot of the international data shows a higher risk of hospitalization for men. And that is a very small impact in Colorado. You'll see that of all hospitalizations is 52% male, 47% female. But that is very close to 50-50. So somewhat surprisingly, we are seeing almost equal numbers of men and women in hospitals. So again, if you think, I'm a woman, I'm not going to be hospitalized, not true. It's about half and half in our state, and that was somewhat surprising given some of the data that shows in other countries, in other situations, a slightly higher. So what that might mean is that those other areas, that it's not necessarily worse for men. It might be that some areas have a higher infection rate among men than women. In Colorado, perhaps because our workforce is more egalitarian, whatever the reasons are, very, very close to 50-50 in hospitalizations. Next slide. This is a very important one. Hospitalization by age group. So you see a percentage of the Colorado population that each age group is, and then currently hospitalized, and then you can see on the far right all hospitalizations. So what you see is, I'm 40 to 49, 13.8% of the people hospitalized right now in our state are my age. And what does that mean? You put it in the context of, in the Colorado population as a whole, 12.9% of the population is 40 to 49. If you're 40 to 49, a higher percentage of Coloradans are hospitalized in your age group than you are as a percentage of the general population. So again, as we know, obviously clinically more favorable, 0 to 9, 10 to 19. This does not have the same effect in young people, developing adolescents, pre-adolescents, that it does in people even in their 20s. And you'll see that 20 to 29 age group, that's over 6.5% of current hospitalizations. So the risk is lower, but you're not invulnerable. 6.5% of hospitalizations are 20 to 29, and then you see it rapidly getting into in the 30s and 40s, very close to parity. And then of course, what we already know, that if you're in your 60s or 70s, you have a significantly higher risk of hospitalization. The 60 to 69-year-olds, a quarter of the people in our state that are hospitalized right now are 60 to 69 years old, just about 1/4. And yet they're only just over 10% of the population. So that is the largest single group of people hospitalized in by age 60 to 69, and that represents a quarter of total hospitalization. So this is very important. I requested this information really just to see who is being hospitalized, because there's a natural tendency. We're all optimists. We all want to think it's somebody else. If you're female, you want to think it's men. If you're in your 40s, you want to think it's people in their 50s. If you're white, you want to think it's people of color. Well, guess what, folks? It's everybody. This virus knows no opportunities. It's the President of the United States for 2 to 3 days. It's your friends and neighbors, and it could be you if you're not careful. Next slide. This kind of shows the age of hospitalization, so you can see that curve. There are the most people hospitalized in that 60 to 69 range, so I wanted to highlight that. And then we're going to get into kind of how long people stay in the hospital. So let's go to the next slide. And this is another way to look at age. Let's go back one more, another way to look at age. So you see that medium, there's the most people, a lot on both sides, but the most in that 60 to 69 range. Just as many in their 50s as in their 70s, so it's good to see that curve, just so people understand that. We see the data, we have it. Who's in the hospitals, now you know. Next slide. The average hospitalization right now is in the 4 to 5 day range. Now that can be a little misleading because if you look at that top one there, the average of the currently hospitalized is closer to 30 days. Why is that? Some of those people are 40, 50, 60, 70-day folks. So the new hospitalizations don't reflect the fact that some people will need to be in there for many months and some will not come out of that group. Many of the fatalities, not all, sometimes it's fatal sooner, but often it's fatal after several weeks in the hospital. And this is important to note. So for everybody that is in that 4 to 5 day range, there's also people in the 2 to 3 day range, and then some that simply aren't getting better and are there for 4, 5, 6 weeks. Some of them eventually recover, and others tragically don't. We do have some fatality and loss in that 4 to 5 day range, but largely it's the people that then deteriorate and get worse. So largely the people that don't make it out have been there several weeks, and it's also just it's science does not yet know why that is some people and not others. It's all groups, it's all ages. Similar risk distribution to hospitalization, but it's truly anybody that could be there 3 or 4 weeks and not make it out, as opposed to 2 to 3 days and make it out. And that's very important. Next slide. The increase in the metro area and non-metro area, both increasing, but this just shows that this is truly statewide phenomena. For the whole pandemic, only a quarter of hospitalizations have been non-Denver metro area. Right now, we're at over 40% non-Denver metro area, and 56% metro area. So it's really spreading more rapidly everywhere. But some of the areas that had been more fortunate are now seeing increases outside the metro area too. Next. This also shows the kind of hospitalization and numbers. It's a useful way to look at the kind of residents by where they are. I think that might be the last slide on that. Is that right? So here's the takeaways, and then I want to get into some announcements we're making today. The takeaways are that this affects you, right? I mean, it doesn't matter your demographic. Now, if you're very young, if you're 12, if you're 8, and this is a good thing because we tell this to our kids, and I hope everybody tells it to yours. You don't need to be as worried about this thing, right? 1-2% of hospitalizations are very young people, and some of those had other pre-existing conditions. But, we like to think, I'm 45, we like to think, oh, it's my parents I have to worry about. Well, guess what? You're 45, it's yourself. A higher percentage of 40 to 50-year-olds are hospitalized right now in Colorado than we are as a percentage of the population. 40 to 50-year-olds are overrepresented in hospitalization, and of course even more so 50 to 60, 60 to 70, 80 to 90. Perfectly healthy, no pre-existing conditions, many of them. And of course there are those additional risk factors that we know about. But we see the hospitalization across all age groups, across all races, across all regions. There is no exceptionalism with regard to this virus. It does not discriminate. Again, if you're very young, you are more fortunate. It is much more minor clinically for the kids. Thank God. Thank goodness, right? What a wonderful thing that the casualties in 10-year-olds and 12-year-olds and 3-year-olds will be very, very small, are very, very small. But if you're in your 30s, your 40s, your 50s, and yes, your 20s, 6.5% people hospitalized in their 20s. This can take people in their prime and make them sick and infirm and hospitalized. Most will get better thanks to the treatments that exist, and some will not. And as a society, we need to make sure that those treatments, those interventions are there for those who need it. Because when you look at hospitalization, some of the first-line treatments like oxygen, most of those patients would not make it if there was not the ability to be hospitalized and get that treatment, right? So it gets many of them through. The high quality medical treatment is what does it. I'm also, we talked about the health dimension. There's two dimensions to this virus, the health dimension and the economic dimension, right? Shifting to the economic dimension, I'm pleased to announce some exciting relief news. Today I'm signing an executive order that allocates $14.9 million in CARES Act funding to support our state's economic recovery, help those who need it. This is a reallocation that's based on updated estimates from agencies on caseload costs and distributions. It's been our goal, and I reaffirm this with our federal delegation this morning, we plan to spend every dollar that we are eligible to do under the CARES Act. It's the federal money we got, right? If we don't spend it, we risk losing it. So we're going to make sure that every federal dollar we got under CARES Act, and I do hope they continue with another bipartisan aid package, does that. So these new investments really build upon a solid bipartisan partnership with the legislature to build upon some of the good work that we did with them to support small businesses, provide food and housing security to Colorado families, reduce evictions. And these investments are particularly important as we go into the winter months, uncertain for our businesses and for our families. Here's a breakdown of the $14.9 million that we're sending out. $6 million to the Energize Gap Fund, which the current level of funding of the Energize Gap Fund, $25 million, with $20 million provided by the bill, $5 million in lending capital, an additional $6 million today. That grows to $31 million. This is a key, ambitious, bold policy that helps get money out to Colorado small businesses with 25 people or less. A grant and a loan. Grants of up to $15,000, loans of up to $25,000. A priority for women-owned and veteran-owned and rural and minority-owned businesses. Priority if they weren't eligible or didn't get Paycheck Protection Program. Both nonprofit and for-profit businesses are eligible. In the first round, and one of the reasons we prioritize this for additional resources, $6 million more dollars, is we got over 6,000 applications requesting over $79 million in grants and $56 million in loans. Even with this money, it can't meet the need. More than half were women-owned businesses, more than a quarter were rural, 12% Latino-owned, 10% Black-owned, and the second round of applications just opened on the Energize Colorado site, and we encourage Colorado small businesses 25 and under to be able to compete, to have the resources they need to bounce back better than before and make it through these difficult times which are not yet behind us. In addition, we announced $2.6 million to the Department of Local Affairs to help housing assistance, to help rent support to those who've been challenged economically or from a health perspective for COVID-19. $100,000 to the Food Pantry Assistance Grant Program, helping our food pantries and food banks meet the increase in demand that they've all been facing. And I visited two now since in the last month or two. And $6.2 million Department of Corrections for the staffing costs associated with the COVID-19 pandemic. So that money is going out the door. The better we do on the health side, the better we do on the economic side. We have been very alarmed with recent trends. The mask wearing will absolutely need to continue. We are renewing the mask wearing requirement for the state. It's one of the most important tools we have. It's really one of the things that separates Colorado from most of our neighboring states that are currently hotspots. The Dakotas, Wisconsin, now the national hotspots. Wisconsin's had to activate their field hospital. We want to do our best to make sure that we can continue with the economic recovery in Colorado, move forward with businesses opening and thriving and consumer confidence, save lives. Masks are one of the best ways to do that. We're strongly supportive of whenever you're around others. And you know what? Look, I was wearing them long before they were required. We were wearing them outdoors when we walk our dog, when we're with our kids. It's just common sense and it's smart, right? Like, think of it. It shouldn't be controversial. I mean, think of it this way: if it was a foot infection that you could reduce the likelihood of simply by wearing shoes, you just wear the darn shoes, even if you were somebody that normally likes to go barefoot and will go barefoot again someday. If athlete's foot breaks out in your gym, you're probably wearing slippers or sandals for a week or two so you don't get it. This is longer and this is higher stakes. This ain't athlete's foot. We talked about the hospitalizations in every demographic group. We've talked about deaths. in every demographic group. And many of the folks that are hospitalized have a significant health impact even after they are released from the hospital, right? Hospitalization is a very high threshold. You're in there 4 or 5 days, you make it out, thank God, you're better. Weeks and months later, many folks are still exhibiting, they've resolved their viral infection, but they are still experiencing health-related issues. Sometimes it even requires medical treatment. So we need to do better. Means better wearing masks, and that's not because I say to do it. It's not because your public health officials say to do it. It's because you care about your health, and you care about your family, and you care about your neighbors, and you care about your job. That's why we're doing it. And I'm challenging our fellow Coloradans to reduce the number of people they are near every day. Some people are more social, and if you're one of those that normally sees 30, 40 people every day, see 10 or 15 every day. And if you're somebody that sees 4, try to see 2. This is the most concerning recent data in the last few weeks that we've had since early July. And we need to do better on the mask wearing, the staying 6 feet apart from others, reducing our social interactions, washing our hands regularly, being smart, being safe, whether you're 23 or 93. Colorado cares about you. Your loved one cares about, your loved ones care about you. I care about you. Let's get through this. I want to talk a little bit about Halloween. Halloween's a fun holiday. In some ways, it's a test for us to see how we can have fun in a safe way. Halloween means a lot of things. It means costumes, means candy, means fun. As with a lot of customs, this Halloween will look different. We need to make sure we do it in a safe way, and it's not a setback that prevents families from coming together over Thanksgiving, overflows our hospitals, costs our economy hundreds of millions of dollars. Here's some simple tips to see how you can have fun this Halloween in a safe way. Keep your distance. That's a common theme. 6, 8, 10 feet where you can. Get creative. Find out ways to not have to be close to people, not physically handing off candy, but at a distance. Outside, always better than inside. Small groups, just your family as a unit. If you absolutely feel you have to trick or treat, your neighborhood, just keep it near your home. Avoid those face-to-face interactions. And don't rely on a Halloween costume mask, right? Most of them have big old holes. So whatever you're wearing for Halloween is great, but make the face mask the part of it, right? I mean, these things are very decoratable. You can probably even find them online very inexpensively where you can put your own image on there. That can be part of a fun costume, right? I mean, have fun with it. It's not the hand that any of us wish that we were dealt. But sometimes in life, when you're given lemons, you make lemonade. So make the mask part of the one national holiday we have where mask wearing is actually a part of that holiday. And so let's make sure that those masks are work. And again, what we're doing in our family, and do what works for your family. We're just going to have, with our 2 kids, we're each going to decorate 2 rooms, and we're going to, when our daughter is in her room, that we'll all knock on our door, and she'll surprise us and give us candy, and then I'll be in one. We're all going to be in charge of kind of decorating 2 themed entry areas, including bathrooms, and we're going to trick or treat in our own house. And if you want to do that, that's fine. If you want to go out, avoid large groups, avoid the physical contact, make the mask meaningful. And have a safe Halloween. Thank you all for joining us today. Before I open it up to questions, I also want to remind folks that election ballots are arriving soon. They've been sent or are being sent today. Keep your eye out for the ballot. Colorado is proud of one of the best and most secure election systems in the entire nation. Our vote-by-mail system is tried and true for over a decade. It's safe, it's secure, it's reliable. It means that you have many choices on how to vote. Of course, you can return your mail ballot. That's usually the best way, at a drop box or in the mail. You can do early voting. You can vote on Election Day. And importantly, keep your family safe through the process. Remember to vote. Our democracy is strengthened when we all participate and make it work. And with that, we'll be happy to take some questions.
Say when you're going to renew the mask order and for how long? I think it expires on the 12th. But
Yeah, that's pending now. So I think all of these are these executive actions are 30-day duration. So that is the authority we have. So it'll be renewed. There's going to be some minor changes to it, as there typically are with these, but I don't want Coloradans to get caught up in what because in many areas in our state they're far more restrictive than the state. They're requiring masks in local downtown areas, outside, and for different age ranges. The state is not for every age, but it's inside only. Just wear a mask. I mean, this is simple. It's just as simple. Like you shouldn't. Why do you need to be told by your county or your city or by Governor Polis? That's not even a relevant thing. I would hope that you care about your family and your loved ones more than you care about your county health officials or your governor. Although I appreciate your well wishes, or your municipal leaders. Wear a mask when you're around others, outside, indoors, and whenever you're around others, because it has a significant impact on reducing your likelihood of getting the virus and spreading the virus, both. And just to create that mask-wearing society where the few people that aren't know that they should also do that to stay safe. And you know what? We care about them too. The people that aren't wearing masks, I care about their lives just as much as I do the people wearing masks. And wearing masks keeps the people that aren't wearing masks safer too. So that's one of the reasons we're doing better. You look at where the outbreaks are now, South Dakota, Wisconsin, they have a lower mask wearing rate than the nation as a whole, around the 45% range. I don't have the recent numbers from Colorado, but last I saw we were in the 80s. And I hope that we can continue that and keep it up. Nobody loves this. It's a piece of clothing that we're are accustomed to now and know that we need to stay safe. But I think we're all looking forward to a day where we can put all of our masks in one big bonfire after the fire restrictions are gone and send them off and not have to deal with that piece of clothing until Halloween in future years. But we're not there, and masks are a very important tool to keeping our spread of the virus, deadly virus, lower and moving forward rather than backward here in Colorado. So there are many local mask orders in different places, and we have our state one, and of course that'll be renewed. But don't wait for some government official to say wear a mask. You care about yourself and your family more than anybody else in the world. Kells cares about yourself and your family, and I care a lot about you and your family. But I know that you care about your own family even more. Stay safe, and masks are part of that. They're not an excuse for avoiding social distancing. They might reduce the spread 40, 50, 60%. That's great, depending on the type of the mask and the environment. But you can't wear a mask and be careless either. A mask in a enclosed room with a bunch of people in a big party might reduce the risk a little bit. But that's not the kind of thing that we can successfully do during this without creating super spreading events that lead the virus to spread out of control and jeopardize the lives of you and your family. I'm the most worried that I have been since early July, since mid-July. This is a significant increase in the virus in Colorado, trending younger, trending whiter, trending not just the Denver metro area, increased hospitalization numbers, not threatening our capacity, but the increase, if it continues at this rate, will threaten our capacity and just as importantly, threaten our economy too, because one of the reasons we had a somewhat successful summer tourism season in our state is we kept our virus relatively controlled. We have to continue to do that if we're going to be successful in attracting visitors to shop in stores in Denver and Fort Collins, to go skiing in Western and Colorado. We need to make sure that we do even better. And wearing face masks when we're around others is an important part of that.
Governor, this is Vinny Delchudice of Bloomberg News in Denver. Regarding hospitals, hospital supply stockpiles seem to be in better shape than earlier in the crisis. But how would you rate the logistics, the dependability, the durability of the worldwide transportation system? Is Colorado making contingencies? Thank you very much.
Yeah, what we saw in the early days in March and April was a breakdown in the global supply chains. Those global supply chains are partially back online, generally back online, but that is subject to outbreaks in other places across the country and across the world. For instance, well, we made tremendous progress on tests as an example, and we had drive-through facilities with quick processing. When they had large-scale outbreaks in Florida and Texas, a lot of the national supplies got diverted to where those outbreaks were. The national labs got backed up, and many of the tests took 7, 8, 9 days to be done. Now we're back to a day or two, 3 at most. Similar with supplies, we recently announced yesterday that we're extending a mask per teacher per school, medical quality masks through Thanksgiving. That's very important. We're able to have enough medical grade KN95 masks to do that. But we do not yet have a sufficient stockpile that is built up to weather a major outbreak in Colorado. Hospitals, many of them, would likely have to go to emergency standards of care, meaning reusing and recycling and providing on the margins not the type of protection that they would want to provide in everyday business for the nurses and frontline workers. So we hope to avoid that. In addition to the hospitalization issue, which we talked about, not having enough beds to treat either COVID or non-COVID patients, which we want to avoid, it's also a matter of making sure we have enough protective equipment to protect those first-line workers. We do today. We will tomorrow. But it is something that we absolutely worry about in the weeks ahead.
Governor Charles Ashby from the Grand Junction Daily Sentinel, you just spent a lot of time talking about masks, and I don't want you to do another 10 minutes on it, but I do need to ask 2 questions here that are not related to each other. One, you created a little bit of a stir on your comments from Tuesday when you said that Mesa County doesn't have to wear masks, and so I wanted to know if that's what you meant.
Yeah, it's pretty simple. I mean, everybody should wear a mask. Like, I don't know why anybody is waiting for their government to tell them to wear a mask, especially if you're somebody who's skeptical of government. Why would you wait for government to wear a mask? Look at the science and data. You care about yourself. You care about your family. Wear a damn mask. Mesa County and a number of other counties are in the protect your neighbors phase where they are devolved more authority. So it's likely that Mesa County, as part of their mitigation plan, because of the increasing cases in Mesa County, is including mask wearing, even potentially above and beyond whatever the state rule is. But there's so much focus on what your county or state is telling you. I even think a little bit of it is an insincere focus, because we often hear some of the harshest critics from those who are least trustful of government. So don't wait for your city, your county, or Governor Polis to say, wear a mask. Wear one because you love yourself, you love your family, and you love your community. And of course, we value that local flexibility. If it's part of a mitigation plan to reduce the increase in rates, we support mask wearing. If counties want to use their flexibility to do a little bit less and do other things, we absolutely can work with the counties that have been successful thus far in that as well.
Thank you, Governor. The other part of my question, the more important one, is that I'm sure you've heard by now about the foiled attempt to kidnap the governor of Michigan, and about the FBI's working with local law enforcement when it comes to potential violence during the election. And just about a half hour ago, the Denver FBI office announced a program on social media to, as part of that same effort. I'm wondering what you know about that, whether or not you've gotten some concerns for your own self, your own personal safety, and what is happening as far as security with local law enforcement from violence.
So the Colorado Department of Public Safety is in regular contact with federal law enforcement agencies to make sure that all Coloradans are safe. That includes me. It includes you. It includes our properties across the state. We obviously can't make any specific comments on any particular threats or concerns. But what I think is most important at this juncture is to focus on what unites us rather than divides us. Our belief in the constitutional principles of our founding fathers, our belief in the fair and free elections, our belief in a democratic republic that aspires to represent the voice of every person, our belief that the only just government governs with the consent of the governed. And regardless of policy differences on the left, on the right, in the middle, up, down, we're all proud to be Coloradans. We're all proud to be Americans. I'm glad Governor Whitmer is safe. We have a great team in Colorado that works on similar matters and hopes to keep all of our elected officials and residents as safe as possible, and a strong collaboration between federal law enforcement and local law enforcement.
De Univision, el Departamento Tri-County planea establecer restricciones más estrictas de COVID-19 debido al aumento de casos. ¿Qué hará usted para controlar la propagación del virus?
En algunas áreas en donde el número de casos es más alto, más hospitalizaciones, por ejemplo, es importante tener más restricciones y apoyo a esas decisiones. Es importante en todo el estado usar tapabocas cuando están cerca de otras personas, pero es lo más importante en las áreas donde tienen un número de casos más alto.
Chris Vanderveen, reporter at 9 News. I have a two-part question. One, I think you touched on a little bit, but I want to get more specific. Should the public in Colorado simply be readying themselves for, while you're doing the mask mandates in 30-day increments, just be ready for masks to be mandated until there is a viable and widely available vaccine on the market? In essence, should we be ready for this through the end of the year, if not beginning of next year? And two, as we are entering the end of the year and we're talking about Thanksgiving and Christmas and all sorts of things that have worried people for many, many months in terms of spread, what is your message to Coloradans as we near the end of the year? Should we be prepared mentally for a more difficult time?
I believe that more of this is behind us than ahead of us. That being said, there's a challenging weeks and months ahead. While we are hopeful that after a vaccine is demonstrated to be safe and effective, the first dosages of that vaccine will hopefully be delivered in Colorado in November and December. We also know that it's not likely to have a level of vaccination available to the general public until early next year. The initial vaccine will be available to nurses and frontline workers and will be very limited to increase the protection for those who are most at risk, but will not be enough to change the public health situation. With regard to masks, it's a question every Coloradan should ask themselves. Should I require myself to wear this extra piece of clothing to keep myself and my family safe? I know that the vast majority of Coloradans are doing so. The vast majority of Coloradans will do so as long as there is a significant threat of this deadly virus in our state.
Hi there. My name is Jessica Snowart. I'm with the Gazette in Colorado Springs. It looks like that we're kind of in a third wave of coronavirus. We had the highest 7-day average, it looked like, since the beginning of the pandemic. Why is that? Is that because schools are back in session? Could you speak to that question?
I think the biggest reason is what we all are experiencing, which is coronavirus fatigue. But just because we're tired of the virus doesn't mean the virus is tired of us. It's still here. Only roughly 5% of Coloradans have some degree of immunity because they've had it. That means 95% of Coloradans are susceptible. It has fertile ground to grow exponentially. And we just need to live like we did in late July, early August, when we were able to contain those rates. We need to be able to be smarter, see a few less people, wear masks when we're around others, try to be 6, 8 feet, 10 feet from others where we can. We need to redouble our efforts. I know we can do it because we did it. We saw this alarming trend in July, which was devastating in some of our neighboring states, in Arizona and in Texas. Coloradans were able to reverse that trend. We now see this alarming trend in Wisconsin and the Dakotas, and we want to make sure that we're also acting as Colorado to reverse this trend before It overwhelms our ability to meet the medical needs of all those who contract COVID and all those who need medical assistance because of other conditions.
I don't know if you saw, but House Minority Leader Patrick Neville announced today that he won't be seeking re-election to a leadership position at the Capitol. I know that you and him have clashed sometimes on coronavirus issues, but certainly issues at the Capitol as well. I'm wondering if you think you'll be able to work better with another Republican in that leadership position in the Colorado House.
Well, I want to thank Pat Neville for his service to our state. He'll continue to be a active, engaged member of the state legislature. We look forward to working with members of both parties, both through their leadership and individually in broader coalitions to help move our state forward, grow our economy, save people money on health care, improve early childhood education, and provide tax relief for Colorado families. Thank you.